who may not be of medical background. And then for the medical background, there is nothing such as maybe CPD points or anything to be gained from here, because it's just for awareness purposes. In this presentation, we will briefly explain what hepatitis is, and then look at the various things that can actually cause it. And then we'll discuss more about viral hepatitis and conclude with what the World Health Organization has put forward as its goals regarding hepatitis, HIV, and other, sexually transmitted infections. We've already done the poll. So let's get started. And like we saw, most of you responded in the poll that hepatitis actually means the inflammation of the liver. Inflammation is basically a normal body response to anything such as an infection, or even maybe any foreign body that enters our bodies can cause an inflammatory process to happen, can cause an inflammation to happen. It is usually spearheaded by the white blood cells. So they produce chemicals that are meant to approach the invader, such as maybe the bacterium or the virus or anything that has entered our body. Or even if you get a cut, bleeding happens, you get a bit of swelling around there and so on, because there is always foreign bodies that enter our bodies, or foreign agents or things or organisms that enter our bodies whenever we get a cut or we get an infection. So our body defense system, which is basically the white blood cells, react to that foreign thing by causing the process, the inflammation to happen. And it is meant to protect our bodies anyway from the invaders. So for the liver, that process, the inflammatory process, is called hepatitis. It has different names for different parts of the body or organs. It may be called differently, but still the same process of inflammation. Things that can cause the liver to get hepatitis are many. Infectious things are the most common, but also we have non-infectious causes of liver inflammation or hepatitis, okay? For infectious hepatitis, mostly it's the viral causes, and the most common viruses are what we call the hepatitis A, B, C, D, and E viruses. Those are the most common causes of hepatitis, viral hepatitis. But we have other viruses like this Epstein-Barr virus, cytomegalovirus, and even leptospirosis, malaria, syphilis, and many other infections can actually cause inflammation of the liver as well, which you can actually also term as hepatitis. So that is about the infectious causes of liver inflammation or hepatitis. The non-infectious, on the other hand, are also quite many. It could be the body reacting against liver cells. So your normal human body reacting against its own body cells, thinking of them as foreign or as invaders. And then that is called autoimmune, okay? Or in that process, it produces autoimmune antibodies against the liver cells. That can also become hepatitis, which is the body fighting itself, not anything foreign about it there. Alcohol is also another very well recognized cause of hepatitis. This could be actually discussed further in another situation or discussion, but it tends to also cause many other things such as liver cirrhosis, which before then would have gone through other steps of liver injury before it reaches cirrhosis level. So alcohol is a well-known cause of hepatitis as well. Apart from those two, sometimes drugs that people take can also cause injury to the liver and then hepatitis. One of such is paracetamol. Very common drug. People often walk and buy over the counter. I have this headache or that fever and so on. So if it is taken overdose, It is a well-known cause of hepatitis. And then other drugs for treating TB infection can also cause injury to the liver. So apart from this, sometimes toxins like chemicals that one could have maybe ingested either in food or water or things like that can also injure the liver. Low blood supply to the liver for different reasons, such as maybe an injury that has maybe cut off blood supply to the liver, or maybe even a blockage of the blood vessel that supplies blood to the liver cells. Such a thing can also cause hepatitis. Of course, cancer of the liver, even cancer from other parts of the body, when the cells, cancerous cells, begin to migrate into the liver, what we call metastasis, can also result in hepatitis. So as much as possible for these non-infectious causes, such as alcohol, maybe drugs, and maybe toxins, as much as possible, the best way is just to avoid these things. To avoid excessive consumption of alcohol, to avoid overdosing yourself with the drugs, to avoid taking, for example, concoctions. There are people who can walk over and maybe they buy, they just grab leaves of trees or roots of trees, boil them up, and then just take a full cup. You don't know the concentration of what you are taking. You don't know the effects on the liver, because the liver at the end of the day is the organ that breaks down everything we take into our body, passes through the liver. The liver is the one that breaks it into pieces. Even if it is a drug, it is the one that breaks it into the tiniest possible chemicals that will now do the work of the drug. So the liver has so much work to do with that, and we shouldn't really be loading it with the things it cannot process safely without injury. Okay, so that's briefly about hepatitis and the different causes of it. Now, we quickly will move on to the viral hepatitis. As I said, the infectious causes are the most common, and these viruses are the most common, the 5 of them. The first 3 that I'm discussing here, the hepatitis virus A, D, and E, I'll discuss them all together because they are not so much of a burden of a public health concern in terms of population affected with it or in terms of the outcomes. However, the hepatitis B and hepatitis C, we will look at them a little more in detail because they are the most common causes of liver problems when we talk of viral hepatitis. Hepatitis A, for example, it's spread from feces to the mouth. Okay, so feces of an infected person contaminating either food or water or fingers of somebody who is not infected, and then when that person takes in that fecal matter, they can contract hepatitis A. Okay, incubation wise, the period is about 2 to 6 weeks. So from the moment the virus enters the body, signs and symptoms will show up within 2 to 6 weeks. The signs and symptoms mostly are these non-specific signs: fever, feeling weak, feeling like to vomit, lack of appetite, maybe joint pains, yellowing of the eyes, which is jaundice, and then enlargement of either the liver or spleen as time progresses. As we saw yesterday, these are not specific signs that you can say, oh, this is hepatitis A or this or that. They can be caused by anything else. Okay, any other infection can cause this. So the investigations, the lab tests will be helpful to specify which cause is this. Okay, in terms of treatment for hepatitis A virus, it is supportive. So if there's fever, you give medicine for fever, maybe medicine for joint pains. If they are vomiting or they feel like to vomit, maybe you give medicine for that, but of course, one needs to avoid alcohol. And if it becomes a full-blown hepatitis, really, which is rare, a medication called interferon alpha can be prescribed. So that is what happens there. For now, hepatitis A virus is said to have a vaccine called Havrix monodose. I'm not so sure about the prevalence of or the availability of this vaccine, because hepatitis A, as we say, is it is self-limiting. It resolves on its own. So this vaccine, I don't think, is all over around us. It is mostly endemic in Africa and the Far East, and hepatitis A tends to be more common in childhood. All right. So whenever you hear something is transmitted through feces, okay, or contamination with the fecal matter, you need to think of sanitation, personal hygiene, and then, of course, conditions of living. For example, crowded conditions and stuff like that could be situations that can worsen or rather increase the risk of transmission of this kind of infection. Laboratory tests are available for hepatitis A antigens. So they will test for the antibodies in the body and then will tell whether somebody is infected with it or not. Treatment, as I said, is supportive. So a lot of rest, fluids, anti-vomiting medications may be helpful, but it tends to resolve really fast in most cases. On the other hand, hepatitis D, so the B we will discuss, the B and C we will discuss in subsequent slides. So I'll go to hepatitis D. For it, it is spread through the same ways that hepatitis B is spread, and we will look at that. The reason is simply because for hepatitis D, it needs hepatitis B virus for its replication, for its reproduction and multiplication in the body. So it cannot basically exist alone as hepatitis D in the body. So that's why it is often a co-infection. So they come either together at the same time, or somebody must have hepatitis B and then D will follow, because it now will have the chance to replicate. Okay. It may also cause acute liver failure or cirrhosis, just as we shall see with the hepatitis B. Treatment may need the interferon alpha, but liver transplantation may be required in certain situations. Remember, it tends to move together with the hepatitis B, so some of the effect could also come from hepatitis B itself. So when somebody is vaccinated against hepatitis B virus, then it means one cannot now also contract hepatitis D virus. So the vaccination against B is also a prevention against hepatitis D virus, just because of that replication thing. From the time of infection to symptoms, it is about 2 to 26 weeks. So a person will have to first get hepatitis B, as I mentioned, and then D will follow. However, there are tests that can diagnose hepatitis D as an individual virus in the body. Hepatitis E, on the other hand, spread is also fecal to oral, like from feces to the mouth, like for hepatitis A. It is more common in older men, and where I read, I also saw that it was associated with the pigs. And I know a big number of people maybe in this call they like to eat pork. So we have to, if you're one of such people, you have to make sure the pork is well prepared, if it is associated with hepatitis E for that matter. It tends to cause high mortality in pregnancy, so pregnant mothers really need to do as much as possible to prevent hepatitis E virus. And epidemics occur in Africa. Once in a while, the numbers can shoot up. There is no specific treatment for this virus. It tends to resolve on its own within 4 to 6 weeks, so nothing really specific to do about it. Vaccine is available, but said to be around in China for now. Yeah, so the treatment mostly is just supportive. Again, a lot of rest, a lot of fluids, that is hydration, and maybe if there's fever or other symptoms that can be treated, and then we treat those. Good. So we've talked about hepatitis A, D, and E. Now let's look at the bigger part of the hepatitis viruses, the B and C. In this slide, which I got from some WHO source, here they're looking at global hepatitis B infections. This is according to 2019, WHO 2019 report. So this is worldwide. There were 1.5 million new infections with about 820,000 deaths for hepatitis B in 2019. Hepatitis C across the world also around 1.5 million new infections, but about 290,000 deaths. So fewer deaths from hepatitis C related causes in 2019 than from hepatitis B related causes, almost 4 times. Okay, but in terms of new infections, almost the same. This is worldwide. If you narrow it down to Africa, somewhere in here, you narrow it down to Africa, the African region, you see here that hepatitis B in 2019, so out of 1.5 million new infections across the world, 990,000 were from Africa. That's pretty much maybe 2/3, right? Maybe 60 to 70% of it. Deaths were about 80,000 in the African region from hepatitis B. And then hepatitis C, new infections in 2019 in Africa were about 210,000 with about 45,000 deaths in Africa. So here the death is about half. For hepatitis C is about half of hepatitis B, as opposed to worldwide where it is almost 4 times the deaths for hepatitis C, 4 times that of hepatitis B. In South Sudan, unfortunately, I couldn't really get very concrete data to explain the prevalence and the new infections and so on. In this country, health information is faced by a lot of challenges, mostly because I think they are not well reported or data is not being gathered into a central pool. So I couldn't really touch on the data for South Sudan as such. Right. So we'll look at hepatitis B virus into a few more details and then also hepatitis C. Like we already said, even in the poll, hepatitis B is actually mainly sexually transmitted. And it is said to be much more infectious than HIV. Okay, much more infectious than HIV. Other transmission routes can be through blood and blood products. It could also be at birth. So a mother with hepatitis B virus can transmit it to the baby at the time of birth, just like for HIV anyway. Incubation for this virus is 2 to 5 months. Other sources say 6 months. So from infection, about 2 to 5 or 6 months that somebody starts to show signs and symptoms of hepatitis B virus. It affects all ages, but it's mostly among the young adults. This could be related to their sexual activity, probably, okay? They are more engaged in sexual activities and therefore transmission. This virus causes both acute and chronic infections. Acute is, so maybe 2 months, 3 months from infection is already showing signs and is progressing so fast, and that is called acute. In the chronic infection, however, the virus can lie in the blood in the body for some time without really showing up, and may actually not show up, but it remains in the blood and it's always diagnosed. So that is chronic infection. An acute infection may last for about 6 months. It might show signs or symptoms, or even without the signs or symptoms. Okay, so anybody with acute infection, even the chronic, can still transmit the virus. Lasting for 6 months actually depends on somebody's immune system strength and maybe the kind of support treatment they get during the acute infection. Otherwise, within the 6 months, if it is full-blown and no early attention is given and so on, many people have gone on to die of hepatitis B because of this problem. Chronic infection. In the chronic infection, antigens may stay in blood for 6 months or more after the time of infection. That's what I just said. It lies in the blood. It's easy to find. It's there, but it's not causing very serious effects on the body. Hepatitis B virus is the main cause of liver cancer worldwide, according to one source I got. So we can imagine how dangerous this virus can be in our bodies. And it is actually, compared to hepatitis C, it is the most common cause of acute hepatitis and even acute liver failure, as opposed to hepatitis C, which tends to take more of the chronic infection arm of this. In 2019, according to WHO, there were about 30.4 million people living with hepatitis B who knew their hepatitis B status. So 30.4 million knew that they had hepatitis. How many more do you think were out there that did not know that they had hepatitis? Right? In Africa, 2% of people living with hepatitis B knew their status in 2019. So you can imagine, like we said, 990,000 new infections in Africa the same year, 2019. But if only 2% knew their status, that means it could have been much more out there who did not know their status, and therefore maybe it would have gone to maybe 40 million plus people who should have known their status if this percentage went higher. Okay, so this just should tell you how big a burden hepatitis B virus is worldwide, but specifically in Africa. Simple knowing of the status that I have this virus or hepatitis B virus is still a problem. Okay, worldwide, again, in the same year, 2019, 6.6 million people who were diagnosed with hepatitis B received treatment. So imagine, out of this 6.6 million across the world who received treatment, only 0.1% in Africa. Okay, so 0.1% of 6.6 million, maybe something like 66,000 individuals, okay, who received treatment across Africa in 2019. So again, treatment of hepatitis B is challenging, right? In terms of vaccination, by 2019, according to WHO, there was only about 85% coverage of the third dose. So people who received 3 doses of the vaccine, only about 85% coverage. So that means some people started maybe the first dose, others managed up to the second dose, but only those who managed up to the third dose were up to around 85% coverage. 43% global coverage for timely birth dose of hepatitis B vaccine in 2019, and it's even much, much lower in Africa. These days, hepatitis B vaccine is available for babies, for infants from the time of birth. It's preferable within the 24 hours, they should be vaccinated against hepatitis B, or at least as early as possible. You can imagine that for timely birth dose, it was only about 43% worldwide. So is it access problem? Is it awareness problem? Is it maybe cost? Okay, we don't know, but this coverage definitely is very low. 97% of donations screened with quality assurance in 2015. So blood donation these days is improved in terms of screening for many of these infectious diseases, including HIV, hepatitis B and C, and syphilis, and many others that could be transmitted through blood transfusion. At least 97% of donations were screened, so that was good. I hope even here in South Sudan, whoever is donating blood gets the screening before the blood is given out. In terms of the burden, incidence-wise, like I mentioned, so you see, 65% actually of the new cases in 2019 were from Africa. See, these 2/3, as I really mentioned in the previous slide, okay? So 65% of the cases were from Africa. In terms of deaths, you can still see much lower. 10% for Africa. So much lower for Africa, very, very much more for the Western Pacific, around 57% deaths. So you can see that much as we get more new infections, I don't know for what reasons, not many of us are really dying of this hepatitis, which should not make us anyway relax about it. We need to still do something about it. How do we diagnose and treat hepatitis B virus? So hepatitis B surface antigen is the most important screening test that tells us that, oh, somebody has hepatitis B virus in their body or in their blood. So it's the one that tells us, it diagnoses infection with hepatitis B, okay? Antibodies to hepatitis B also can be screened. There are other antigens that can also be tested. I don't want to go into details of these two, but it's just mainly for the medical personnel to just understand the level of infection and so on. But genotyping, the gene for hepatitis B virus can also be tested, especially in public health laboratories, to just maybe create awareness or inform prevalence and stuff like that. The most important test all of us need, if we have not already done it before, is the surface antigen test, because it shows us that we are either infected or not. And once we are not infected, we should take the vaccine for hepatitis B to prevent it. Other tests for somebody infected with the hepatitis B virus would include liver function test to tell us the level of damage on the liver. It is usually seen in the liver function test through some products that the liver produces. Often when there is injury in the liver, those products go higher in the blood than the normal levels known, okay? So that can happen not only for hepatitis B virus anyway, but for all other viral or non-viral hepatitis, we can still do liver function test to understand the level of injury that is already done on the liver. Liver ultrasound can help the person to visualize structural changes on the liver, and they might be able to inform how far physical damage on the liver tissue has gone. A biopsy is taking a small bit of the liver tissue and taking it to the lab, analyzing it for mainly to diagnose whether it is a cancer or it is other causes of liver injury that are there. So that might also be done, especially if it is possible or available at the place. But to simply diagnose hepatitis B, it's the surface antigen test that is needed, and then the liver function test to guide on maybe treatment plan. Treatment for acute hepatitis, which already is now showing signs of liver failure, somebody needs to rest more, vitamin supplements, avoiding things like alcohol and other liver damaging drugs is helpful. You will see that there is nothing very specific treatment for acute hepatitis that has been caused by hepatitis B virus. So the treatment is more of supportive, helping the body to recover and maybe immunity to get stronger and hopefully overpower the virus. Otherwise, most people who get acute hepatitis with the liver failure, as we have already said earlier, they tend to just die because of the effects. For chronic hepatitis, somebody might be put on antivirals. Commonly, tenofovir and lamivudine are available. If it is also available and affordable, maybe interferons can be done. In the in the worst case scenario, liver transplantation might be needed for somebody to really survive in the chronic hepatitis infection. The good news, as we already said, is the vaccine is available. So test, take the vaccine. And that is if you are hepatitis B virus negative. Hepatitis C, on the other hand, mainly transmitted again through blood and blood products. So sexual intercourse, use of contaminated or unsterile needles, all these can really transmit the virus as well. Incubation period is about also about 6 months. 14 days to 180 days, average is about 56 days. It, like for hepatitis B, it can also cause acute and chronic hepatitis. Chronic hepatitis is 85% of the time. So most of the clients, most of the patients with the hepatitis C virus tend to develop chronic infections. Okay. And then those who develop chronic infections, most of the time, about 25% of them will develop liver cirrhosis in the next 20 years. So chronic infection, and 25% of those with the chronic infection tend to develop cirrhosis of the liver in about 20 years. Hepatitis C is diagnosed using antibody test, and the genotyping can be done as well for public health laboratories. No vaccine, unfortunately, this one has no vaccine. The most common reason for liver transplantation in the West, because most people, as we said, develop chronic infection. They go on to develop, some of them go on to develop cirrhosis. And when the liver gets cirrhosis, pretty much it will not work. Liver cirrhosis, as we shall see in the next slide, is the liver tissue becoming more of fiber than actually a soft tissue that should do its work normally. In that situation, it will not function well, and the best treatment will be to take it out and put another liver. So that's transplantation. Treatment varies with the presence or absence of cirrhosis and the age. So I didn't want to go into the details of this, but you can go on to read more. If there is cirrhosis, if there is no cirrhosis, and then is this a young person, is this an old elderly person? Treatment options are based on those considerations. In the treatment, there are many regimens of antivirals that are used to treat hepatitis C, but the backbone is the sofosbuvir, or the sofosbuvir-based regimen is used to treat hepatitis C. It can take 12 weeks. Other people can take up to 24 weeks. So daily treatment, daily medication, and so on. The good news about hepatitis C is that about 95% of the cases do get cured. So it's not that 100% curable, but yes, most of the people will resolve, especially when they get the right treatment at the right time and they complete it for the given time, for the prescribed time. Yeah, so you just got this picture. See how nice, smooth the liver tissue should look like. And then when it becomes cirrhotic, what it looks like. So this is liver cirrhosis. This kind of liver now will not function as well as this, because the tissue has become more of fibers, more of tough tissue than the soft, healthy one there. Okay, so cirrhosis can arise from many things, including alcohol, as I earlier mentioned, hepatitis itself, and then other conditions. Okay, liver failure patients are treated with transplantation. Like I said, when it gets to such a stage, this cannot work again. So just take it out, give another liver that still is functional. In 2019, 15.2 million people living with the hepatitis C knew their status. Okay, so earlier we said 30.4 million for hepatitis B, and then 15.2. So you see hepatitis is over 45%. Over 45 million people in 2019 who knew they had either hepatitis B or C, right? Now you can imagine how many people are actually living with the hepatitis B and C combined worldwide. If 45 are those who knew their status in 2019, and that's about 4 years back. By now, where would we be, right? So you would imagine over hundreds of millions of people out there might still be living with these two viruses undiagnosed, as opposed to HIV, for example, which is estimated to be around 39 million people living with HIV worldwide. You see, so you will see that hepatitis B and C should be of more focus than HIV actually, because after all, in terms of transmission, almost the same way of transmission, but in terms of the burden, they are more of a burden in terms of population affected, the deaths, right? So, but most of the focus at the moment in governments and public health institutions or organizations, they tend to focus at the moment more on HIV. But if this awareness can cause a change in this, and we individually start to advocate for more attention on hepatitis viral infections, I think we will change the situation faster. So again, 5% of people living with hepatitis C knew their status in Africa, and then only 0.5% of those who knew their status were accessing treatment in 2019. This is worldwide, right? This is Africa. So only 0.5% of those accessing treatment were from Africa. And most of these were in Egypt. So the rest of sub-Saharan Africa, maybe if they knew their status among these 5%, many of them probably did not afford or did not access the treatment. It's very expensive, and it takes, 3 months, 6 months or more. It needs regular monitoring with the tests that might be also expensive. A lot of reasons really around that, but still we could do something else about it. So what are generally the signs and symptoms of viral hepatitis? We have both acute symptoms and then chronic. So in the acute hepatitis, whether it is from hepatitis B or C or any of those other viral infections, pain in the abdomen is possible. People can pass dark urine, okay? They can get fever, they can get joint pains, loss of appetite. They may have a feeling to vomit, or actually they vomit. They get fatigued, the yellowing of the eyes, jaundice. If the jaundice increases so much, it can also result in itching. Then the organ enlargement that I talked about, the liver or the spleen, especially for the liver, due to those structural changes that happen, the liver can become big. You will see that most of these patients for hepatitis, many of whom actually go on to die, they are thin, but with a huge stomach, sometimes with a lot of accumulated fluid in the abdomen. So those are some signs in the acute phase. For those who develop chronic hepatitis, they can have also the malaise, the weakness, they easily get fatigued. Something that you could do, like maybe walk from here to Custom and come back home normally. Previously, you would do that in maybe 20 minutes. These days, if you try for just like 5 minutes, you are already tired. So that's what we call easy fatigability. Activities you usually used to do without any challenges, now you cannot do them because you easily get tired. Of course, the enlarged liver, muscle pains, they touch you everywhere, it's all painful. And then the elevated liver enzymes. These are the things I talked of that are tested. When we say liver function test, we actually are testing for mostly enzymes that the liver produces and other products. So these are things that can also be seen in the chronic hepatitis infection. If viral hepatitis is not treated, it can go into complications sometimes, depending on the cause, but especially if it is hepatitis B or C virus, people can become dehydrated, right? They can also have low potassium. So, and potassium is one very important nutrient or element in the body, especially for cell function. Potassium is very important. So when it becomes very low, it is one of the reasons actually patients will feel very tired easily, because the cell will no longer function so well to give the energy they need to do things. So that is a complication of viral hepatitis. Of course, some of the infected persons can become chronic carriers of the virus. we also term it as a complication, because as we saw for hepatitis C especially, chronic infection is more common, and some of them go on to develop cirrhosis. So the chronic carrier state is still a complication. As opposed to those viruses that resolve by themselves soon, the fulminant hepatitis is also considered a complication. So severe sudden onset hepatitis from infection, that is a complication of viral hepatitis. I already talked about liver cirrhosis, liver cancer, especially with hepatitis B virus, sometimes with the hepatitis C. There could be many other complications here, like also the organ enlargement and so on. All those are things that can develop out of infection with the hepatitis virus. Prevention, we have general measures and then mostly vaccination. General measures now tackle those, especially the A and the E, that are transmitted from feces to the mouth. So hand washing, proper personal hygiene, environmental sanitation, maintenance, okay, can be really helpful. Controlling and also screening food handlers. Yesterday, I think when I discussed typhoid, I mentioned this, and I challenged that our public health system needs to get over this and actually on top of it and get on top of this. Food handlers need to be screened for all these things so that they are handling food and we are safe eating their food that they give us. Avoid sharing sharps, dispose them of well. Unprotected sex, you should also avoid this, because we have seen, especially for hepatitis B and C and D, sexual transmission is one of the ways or routes of infection. Of course, screening donated blood. If you are a medical personnel who works and closely comes in touch with the body fluids like blood, you might want to always make sure you wear personal protective equipment, such as gloves, for example, okay? That might also reduce the chance of exposure to infected blood. Vaccination is the other most important measure, especially for hepatitis B, using the vaccines that we said are available. Please screen for hepatitis B surface antigen. If it is negative, go for vaccination. As we shall see in the next slide, it is just 3 shots given today, 1 month from today, and then 6 months from today. And then you are good to go, all right? The good news also is that the vaccine is now a part of what we call the pentavalent. Pentavalent is a vaccine that has, it contains, so it's a combination of 5 vaccines put all together, and they are injected, especially for babies from 6 weeks to 14 weeks. They are given, I think, 3 doses of pentavalent. The pentavalent has 5 different vaccines combined, including hepatitis B. So this is also good news. We hope that generation, maybe 1 or 2 ahead, there might not be any more hepatitis B virus, because of this kind of vaccination. So we should also ensure babies get that vaccine. Somewhere I landed on this as the International Hepatitis B vaccine schedule for all ages. So here are some of the different vaccines and maybe the age and so on. So for babies, this is for both adults and children and babies. And then there's another one for babies. So we have a 3-dose vaccine for infants less than 1 year. And then there is a 4-dose combination vaccine also for infants. For the 3-dose, as it says, so dose 1 recommended within 24 hours of birth or as early as possible. And then dose 2 is usually 1 month after dose 1. And then dose 3 is 6 months after dose 1. So that's the same scheduling as for the 3-dose vaccine for children 1 year and above and adults like us. So that's what I mentioned. So now, 1 month from now, 6 months from now, and that's it. Hepatitis B vaccine schedules. So These ones sticked with the blue background are monovalent hepatitis B. That means they only vaccinate against hepatitis B. Then these others, as I mentioned, 6 weeks, 10 weeks, 14 weeks, are what we call the pentavalent. They have other vaccines added to it. Okay, for example, for hemophilus, for diphtheria, for tetanus, and so on. So there are 5 of them there. So this is what I said is now common. All babies should be able to get this. And of course, all of us adults should be able to get this dosing schedule if we are hepatitis B negative. So what does the WHO say? They are saying that by 2030, they would want new infections with the hepatitis B and C to drop all the way by 90%. All right. 2020, they had a goal of 30% reduction in new infections. By 2030, which we are about maybe 6 years away or 7, WHO would want to see a drop in new infections of these viruses by 90%. In terms of deaths, they want to reduce deaths from hepatitis B and C related causes by 65%. But we have seen the data there in the previous slides in terms of number of people who know their status, number of people who get treated, very, very low figures. You wonder whether in 7 years' time, it is possible for the whole world to achieve this, and particularly for Africa, where most cases are, right? So, from 6 to 10 million infections in 2015, WHO would want to see only about 900,000 new infections by 2030. How do we get there? Such awareness as this is helpful. We spread the news, we help people screen for hepatitis B virus, C virus. If they don't have either of these, they should be able to vaccinate for hepatitis B, and then for hepatitis C, continue to protect by using the other measures I explained in the previous slide, right? WHO would want to see from 1.34 million deaths in 2015, dropping to under 500,000 deaths by 2030. Again, we can contribute to that in one way or the other. So to achieve those, the WHO came up with what they call the shared vision and goals. What is their shared vision regarding HIV, viral hepatitis, and sexually transmitted infections? So for the shared vision on viral hepatitis, WHO is envisioning a world where viral hepatitis transmission is stopped and everyone living with the hepatitis has access to safe, affordable, and effective care and treatment, right? And the goal is eliminate viral hepatitis as a major public health threat by 2030. This is according to WHO. You can read for HIV and STIs if you have the chance later with the slides. But the question in this discussion is, how do we ensure this vision and the goal are achieved? Okay. For those of you in this call who actually work in health facilities wherever across the country or outside it, you might want to start initiating maybe awareness messages at your outpatient departments, for example. Do you include awareness messages on hepatitis? If you do the testing, do you educate people that they can test or screen for hepatitis at your health facilities? So that's one thing we should also be asking to do, right? In summary, like we've seen, hepatitis, which is inflammation of the liver, can be caused by many things, but we said the most common causes are viruses. And also, as we have seen the figures, hepatitis B and C viruses are the most common causes, and yet they also cause acute or chronic infection. So can be either side. Hepatitis B can be vaccinated against. So what we need to do is to screen for the virus, and if we are negative, we get vaccinated. Like I said, even babies also need to get the vaccine, the pentavalent for that matter. In Juba, I tried asking around, and I think I was told that EB Clinic, which is in around Sukmelisia in Munuki, Juba Medical Complex, and AMI or AMI clinics, I think these are facilities I've been told have the vaccine. I was not able to establish the cost. So if you are in Juba or any relative in Juba, you can support them. I would recommend you send them over there to screen and maybe get the vaccine. Please let us remember that there is no cost of any prevention that is more expensive than a life. Like some of you mentioned in the beginning, we've seen people dying of hepatitis. Some of them are our loved ones and so on. You would think if they were screened earlier and vaccinated, maybe they wouldn't have died by now. So let's not worry much about cost issues. We rather try to afford and then stay longer to make more money. Acute hepatitis B has no specific treatment. While the chronic hepatitis B can be treated with the antivirals, like we already said, hepatitis B is the most common cause of liver cancer. So we should really do our best to avoid it in the first place. Hepatitis C can be treated. 95% cure rates are reported. And the common complication of hepatitis C is liver cirrhosis. Personal and environmental hygiene, safer sex, remain very, very important roles. They play key roles in prevention of viral hepatitis. So along with the other measures I already mentioned, we should tell people to stay away from hepatitis virus. Other non-infectious causes of hepatitis should be avoided, most especially alcohol, and of course, overdosing with the drugs and so on. I liked this when I saw somewhere, keep calm and get tested. So I added there for viral hepatitis. Yes, so get tested for viral hepatitis. And if you don't have it now, please get vaccine for hepatitis B at least, and stay safe. Thank you all for listening. Bida, are you in the call?
Yes, I am in the call.
Very good. Thank you. So I'm quickly perusing through the chat box. Why is it some hepatitis B virus tests come negative, turned positive after, sometime again, vice versa? I'm not sure about this. So I'm tested today negative, or rather today positive, and then again I'm negative in the future. If for example it is that I'm positive today and then after some time I'm negative, like we discussed, like I said, it can resolve on its own sometimes. Okay, the acute infection can resolve on its own, very rarely, but it happens. So maybe that is a situation of that kind, that somebody's immunity was able to fight off the virus. I can't think of another. But of course, if I'm negative today and then I test positive next time, it's clear maybe I got infected along the way, right? Yes, I can see the results. Many people, thank you. My uncle died April this year. Condolences to you, Mawa. Good afternoon, everyone. Can hepatitis B virus be cured? If not, how can one live positively with it? No, it cannot be cured. Like we said, if it causes the chronic infection, which means it lives in the body for long, there are treatments that can be given, medicines that can be given. In the process, usually somebody gets routine monitoring tests to determine whether it is becoming acute or it is becoming more dangerous in terms of signs and symptoms and injury level to the liver. So yeah, that can be done, and hopefully it can be suppressed and remains in the blood without any problem. That is, so living positively with it will include things like, one, sexual activity such that it is protected sex most all the time, because you also don't want to infect someone. Two is avoiding other hepatitis causing things, particularly alcohol. Okay, and then maybe not taking drugs that are known to have very serious side effect on the liver. Those are other things. And of course, regular checkup on the level of injury, if any, and so on, will be really helpful to determine what next can be done. Okay, Kenyi, I hope I've answered you. For those with the hepatitis B virus but low viral load, what should they do? Yes, so that's what I've just said. They continue to monitor maybe every 3 months, check the viral load, continue to improve their nutrition. Improving nutrition, such as including things like fruits, vegetables, and so on, are known to improve immunity. Okay, the body immunity. So strengthen the body immunity, in other words, and also avoiding the other things we said we should avoid, like alcohol. Hi, Doc. Can you share with us the links? And for yesterday's, yes, all the slides will be shared. The link will be shared, and you can access them from the shared drive. Someone vaccinated against hepatitis B vaccine without knowing his status, what could be the effect to that person? It might depend on whether the person had hepatitis B infection or not. If there was no hepatitis B infection, then the effect is good, that they are already vaccinated, and should the infection happen in the future, the body would be able to respond better. But if they were vaccinated when they already had the infection, and yeah, so it would be now observed whether the vaccine would have worsened the infection or not. Okay, there is no specific answer to that situation. Please, your WhatsApp contacts for bilateral consultations. Join the group, please. We have a WhatsApp group for all our attendants of such sessions. You can always post any questions down there in that WhatsApp group, and we will respond. Will there be attendance? Yes, I've seen it has been shared there. You can register. How long is the vaccine last in the body? Hepatitis B vaccine, I think it's 10 years. Maybe I will respond to that also in the WhatsApp group. I will post the answer. I will check it up. But most of the vaccines are 10 years, and then a booster dose will be needed. So I will need to cross-check that if there is need for any booster. Is there any medication for the hepatitis B vaccine? I mean, B virus positive person? Yes, I mentioned that. There is medication for hepatitis B virus chronic infected persons. Okay, if it is acute and it's already showing up with the signs and symptoms and so on, no known medication can help apart from just supporting the body with the nutrition and maybe treating things like fever and other symptoms that show up. Wow, thank you so much, Bida. Let me leave it over to you to moderate if there are any people who want to give comments or supplement and so on. Bida, over to you.
Wow, thank you so much for the nice presentation. I'm giving you a virtual hand clap. That was excellent and quite intensive, comprehensive. I've learned a lot of things in regards to viral hepatitis, and this will already boost my knowledge on these things. And at this juncture, we are giving an opportunity to everyone in the call to be able to make additional comments if you're from a medical background, or if you want to share your experience in regards to the topic that we have discussed here, or if you have questions that you would like to ask, please do that. I already see a hand from Alid. Alid Mashek, you're welcome.
Yeah, thank you, moderator. Thank you, Dr. Leju, for the well-elaborate presentation. Yes, I would want to just comment on the prevention part of the viral hepatitis. Yeah, like the presenter mentioned, yeah, there is no much that has been put on combating the rise on viral hepatitis, because the government is now on HIV, and it is known countrywide. There is less on hepatitis, and it is also silent like HIV. So it is the awareness for those who are working in the health facilities. It is the awareness part that we need to put as a priority now, because people are not aware. They have no knowledge until when the virus have progressed to the chronic levels. That's when they will seek help, when there is nothing that can be done. And that's why we are seeing that people who are dying, because they do not know. People will go beat around the bush, it is this and this. Yet it is what? It is hepatitis they are battling with. So the most important thing is putting awareness in the community that there is this silent killer, just like HIV. And if need be, yeah, it can be incorporated. We can use all the ways, because now there are a lot of modalities now on tackling HIV. It is the same thing that can be applied just locally. Let people be aware that hepatitis kills. It has vaccines, can be prevented by vaccines. Then, of course, people will take it up. Yeah, but it is quite challenging that people do not know. Yeah, even the place where I come from, people do not know. There is little knowledge on this hepatitis until, and there are a lot of myths around what the hepatitis, just like HIV. The stigma is also high. When someone is diagnosed with hepatitis, they are just stigmatized, as you see with the people living with HIV. Yeah, so my call to everyone, those working, those are medical personnel, awareness is the most important thing in the area down there, so that people get to know their statuses. Yeah, if you know your status, then you can be vaccinated. Yeah, so when I was in the medical school, that's when I got vaccinated. That was around 2015, those years. And it was mandatory for everyone. You need, before you go for any practical or practice or attachment in the hospital, you must show your card that you are what? You are fully vaccinated, because you are going to also interact with the patients that are negative. And if you also have the hepatitis, you can infect patients. So it is everyone's responsibility, and I really want to applaud Dr. Leju for the nice presentation. Yeah, I didn't know about the program until I just bumped into it on Facebook. But it was really a nice interaction. Thank you.
Perfect. Thank you so much, Alit, for the call to action. Like you said, it's everyone's responsibility. Especially medical practitioners have a role to play in order to tailor this information and see how they can put it out to their clients or even the community at large. Thank you so much for that. Yes, I see a hand from Dennis. You're welcome.
Thank you. Good afternoon to everyone. First of all, thank you very much to our facilitator, Dr. Lejo, for the wonderful presentation. In fact, these are the realities on the ground, especially for us who are practicing delivering health services to the vulnerable community down in the villages. It's true, like hepatitis B is one of the viral infection that in our country is not being taken seriously. You find people are mainly focusing on malaria, like the malaria control program, HIV and TB. So those are the ones that people are mainly focusing on at the stakeholders meeting, at the stakeholders level, where they draft policies. But hepatitis B is killing people a lot, and these are not being recognized. So the recommended practice is, for us, we need to give much more of health awareness. For instance, in the hospital where I worked, one of the county hospital, hepatitis B, syphilis, malaria test is mandatory for any ANC1 visit. So once we get a mother who has hepatitis, you cancel the mother. But with time, this testing kits also is a problem sometimes, because the government is not investing in it. It's the NGOs who normally supply. And this makes us to do selective screening, which to me is not fair. But the selective screening is due to the test kit, which has to last for some duration of time. So this kind of master class is really very good. Big up to Excellency Foundation. It's now my second time. I did for me last time, and this one also. This is more of CME for us who are in the medical field, and looking forward for some interaction with you people. Thank you and have a blessed Sunday.
Thank you so much, Dennis, for the comments. And Dr. Leju, there's a question in the chat box. Someone is asking that after how long should one get revaccinated for a booster dose, or there's no booster dose for hepatitis? So, and then also my question is, I don't know if I got it clearly, but you were saying that like the hepatitis has no cure, right? Your mic is off.
Yeah, go ahead. What were you saying once again?
I was saying there's one question in the chat box.
Yes.
Like
yes.
The question is, after how long should one get revaccinated for a booster dose, or is there no booster dose for hepatitis vaccine? Hepatitis B vaccine. And then my question is, like, if one gets infected, is there treatment, and then can one get cured or not?
So with the treatment for hepatitis C, as I mentioned, there is a 95% cure rate that I have seen somewhere. I think in the South Sudan South Sudan hepatitis treatment guidelines or something. I will share all that with the slides along. Anybody can read more in that guideline. I have seen a 95% cure rate for hepatitis C, especially with the treatment, the chronic one. For hepatitis B, the chronic one, yes, can be treated with the medicines I mentioned. In terms of cure rate, I have not come across it, because I think those medications, just like for HIV, they just suppress the amount of virus in the blood and allow somebody to live quite a normal life. I have not come across a cure for hepatitis B, just as there is no cure for HIV. In terms of booster dose for hepatitis B vaccine, I also have not come across it, and I earlier said that I will look it up, and maybe I will share if I get some other information to that. But in this schedule, you see that they only mention, depending on the type of vaccine used, they mention either the 3 doses or 4 of them as full vaccination. Okay, so I will look it up. I actually got this slide from a website. They call it hepatitis. What do they call it? They call it Hepatitis B Foundation. So I will look at that website again to see if there is any booster dosing needed and after how long. And I will post that. But I want to thank those who have also given their comments, including Alit and even Dennis. Yeah, vaccination is very important. I took mine in 2014. So I'll see if I'll confirm if I need a booster dose 10 years from that time, which will be next year, or I don't need anymore. So I'll confirm that answer and provide in the WhatsApp group for the booster dose, whether it is needed or not. So far, I have not come across it. Bida, over to you.
Okay, great. There are no extra comments from us. We would like to sincerely thank you so much, Dr. Leju, for your time, and then for as well as sharing your knowledge. This is very encouraging. And then also I would like to thank each and everyone who registered, and also for taking their time to be able to also share their expertise, as well as get some of the information that has been shared here. And then the resources will be shared with all of you. We will put the presentation on SlideShare, and then you will download from there. And any other information will be shared in the WhatsApp group. And I will also try to send this via email. This recording is available on YouTube, so anytime, even after several years, you can still revisit it to go and listen to the conversation that happened on this particular day. We usually do not take numbers to add people to the WhatsApp group. So what we do is we just give you the link, and then you are able to join using the link. Or else what you can do is you can send us a WhatsApp message to our number. Our number is this. I'm just putting the number in the chat box. So just text me there, and then I will send you the link. It is usually easier when the link is sent to you via WhatsApp. You can just click there, and then you can actually easily join. Than when usually via browsers can be pretty complicated if certain setup is not properly done. We wish you the very best of your Sunday afternoon. Do take very, very good care of yourselves, and happy new week as you start work on Monday. Thank you so much.
Thank you.